And let's get started with today's important discussion on the effects of COVID-19 on mental health and what many are considering the new pandemic. Our esteemed panel of 3 mental health experts will offer their unique perspectives on the global mental health crisis, the new effects of COVID-19 on mental health, and practical advice on how best to help friends or loved ones suffering from severe mental illness. We're thrilled to be joined by Dr. Robin Mama, Dean and a full professor at the School of Social Work at Monmouth University. Dr. Mama also serves as the representative of the International Federation of Social Workers to the United Nations in New York City. In addition, she has the position of chair of the International Committee of the National Association of Social Workers. Please welcome Dean Mama. Next, we welcome Dr. Stephen Theccanat, a practicing psychiatrist and former chairman of psychiatry and outpatient medical director at Monmouth Medical Center. And we're also lucky to have Dr. Steve as a Shorthouse board member. Welcome, Dr. Steve. And last, but certainly not least, calling in from the beautiful island of Kauai on Hawaii is Jack Yatsko. Jack is the Chief Operating Officer of Clubhouse International, which is the coordinating center for over 310 clubhouses in 32 countries around the world. Jack has over 35 years of experience in the mental health field, and we're thrilled to bring his unique experience to our discussion. Welcome to all of our guests, and let's get started. Dr. Mama, I'd like to begin our discussion by asking you to provide us with an overview of the global mental health crisis as a way to help frame the more specific conversation about the new impact of COVID-19 on mental health.
Thank you, Peter. Thank you for the invitation to be part of this panel. It's a pleasure to be here with all of you as we discuss these important issues. I will try to give you a picture of what's happening globally around mental health, as well as a national picture, and then say a few words about COVID-19's impact on mental health. There's a lot that we could discuss and a number of things that we could talk about and get into this more, but I'll try to be as succinct as possible. So in terms of global mental health statistics, the World Health Organization estimates that there are 1 in 4 people in the world who will be affected by a mental or neurological disorder at some point in their lifetime. Currently, there are 450 million people who are affected, which places mental disorders along the leading causes of ill health and disability worldwide. 2/3 of those people will never get help. And that's because of stigma, discrimination, and neglect around preventative care. When we look at the types of disorders that are most prevalent, and I would say these hold true for the national picture as well as the international, there are 4 of them. Depression is the first. And it's estimated that about 264 million people are affected by depression. And of course, it affects more women than men. Bipolar disorder affects about 45 million people worldwide. Schizophrenia affects about 20 million people worldwide. And then finally, there's dementia, which affects approximately 50 million people worldwide. So when we look at national statistics, there are some similarities with the global. So there are 40% of countries around the world who have absolutely no mental health policy, and 30% have no mental health programs in their countries. There are 33% of the countries worldwide who allocate less than 1% of their total health budgets for mental health, with another 33% spending only about 1% of their budgets for mental health. 25% of countries don't have the 3 most commonly prescribed drugs used to treat schizophrenia, depression, or epilepsy. And since Dr. Steve is with us on this panel, he might find this statistic interesting. There's only 1 psychiatrist per 100,000 people in more than 50% of the countries worldwide. So that's an interesting and staggering statistic. If we look at what has been happening with mental health in terms of COVID-19, the World Health Organization actually conducted a survey from June through August of this year in 130 countries across their 6 regions. And here's what they found. 60% of countries that answered the survey reported disruptions to mental health services for vulnerable people, including children, older adults, and women who require antenatal or postnatal care. 67% reported disruptions to counseling and psychotherapy, and 35% reported disruptions to emergency interventions, including those for severe substance abuse withdrawal. Many countries tried to bridge the gap during the pandemic with teletherapy or telehealth, but there's a disparity as well between high-income countries and low-income countries and who was able to do that. 80% of high-income countries were able to bridge that gap a bit with teletherapy, but it occurred for less than 50% of the low-income countries. So this is just a little bit of the picture of what's going on, and I hope this is helpful in terms of our discussion as we go forward.
Thank you, Dr. Mama. Dr. Steve, as a practicing psychiatrist, how has COVID-19 impacted your practice and your patients?
Thank you, Peter, and thank you, Dr. Mama and Jack, for being part of this panel. There was a recent article in JAMA that came out about a week ago that they did a survey on people just in the general population to try to find out how they have been impacted by COVID-19. And they have found out about 40% of individuals who don't have a pre-existing psychiatric or mental health issue. 40% have issues around depression, around substance abuse, around anxiety, around trauma. And this is about 3 to 4 times more than it was in 2019. So COVID-19 has significantly impacted how people have responded to this pandemic. And when I look at my private practice, I would say about 98, 99%, practically every single person since March, every single time I speak to them, the issue around the pandemic comes up, and it's about how do I deal with the shopping? How do I deal with school? How do I deal with teaching my kids? When will my employer ask me to come back to work? And predominantly, the number one piece I see is anxiety. So you have this fear about what's going to happen to me when I go out there, and I'm going to be subjected to the virus. So it creates a lot of uncertainties. So that's where the trauma piece comes into play. And then in addition to that, there is this general fear because they have found another study where people with psychiatric illnesses, if they get COVID-19, there's double the risk that they're going to die from this disease. So it's a very significant problem for a lot of individuals. So, I've looked at what, people, the current estimation is 2 out of 5 people in the United States, they know somebody who has either died from COVID-19 or were hospitalized from COVID-19. They personally know them. So that also creates another piece of anxiety. If you have witnessed a family member or a friend who has been very sick, or a family or friend who died from COVID-19, there are psychological ramifications of that trauma, of how to deal with that. So one of the problems that I see is we should never have called it social isolation. I mean, we should have called it physical distancing with social connectedness. Our goal, especially with COVID-19 and people isolating at home, the people suffering the most are those with psychiatric issues, because they've already been struggling with a lot of isolation, and it's gotten so much worse because they cannot go out, they cannot do things with other people. Individuals who don't have a psychiatric problem have struggled with this, and people with mental illness struggle even more with the social isolation.
Thank you, Dr. Steve. Dr. Mama, a question back to you. In the news, we hear a lot of negative information about college-age students spreading the virus, but we hear very little about the mental health state through the pandemic. Can you comment a bit on what students are going through right now?
Sure. Thank you, Peter. I think all students want to have some type of normal life at the moment. And I think that's where some of the news has come out about them being at risk, or, participating in activities that put them at risk and then put others at risk. But at the same time, there's a lot of loneliness with students. They feel isolated, they feel lonely, they feel sad. They're just as unsure about their future as we are as adults and what's going to happen. And even as they come back to college, they are desperately wanting a college experience. You know, they have an idea in their head about what that should be like, and they want it. And it's very hard to then have that be restricted.
For the parents out there with college-age students, is there anything that you can advise us as a way to help them cope?
You know, I think communication is the biggest piece. And everyone has to really talk about their feelings around this. Normalizing that we all feel a little bit stressed, that we all feel a little isolated, that we all are unsure about what's going to happen, but that we have to be as flexible as possible. And I think trying to continually hope and keep a good outcome, a good outlook, but also to be realistic and to talk through everything that's happening, I think is important.
Thank you. That's helpful advice. Dr. Steve, navigating the mental health crisis is very daunting. If a loved one or someone you know is experiencing a mental health crisis, what advice can you give to our viewers on how to get help and get started?
Yeah, and that's always a very difficult situation for a lot of people because they really do not know what to do. And people are not trained to really assess or make a determination of how seriously sick somebody might be. So on our Shore House website, we have a resource page where we have kind of listed various things that individuals can do if they're having an issue or a problem with a friend or family member. And the number one safety issue, a psychiatric emergency safety issue, is always things like, is somebody talking about suicide, or they're talking wanting to hurt somebody else. And that's, for psychiatry, it's always a number one emergency situation. So there's a phone number for the crisis center at Monmouth Medical Center. If you call them, they're available 24 hours, 7 days a week. Let them know what the problem is, and they'll walk you through what are the steps that need to be done in regards to trying to give this person immediate help, because this is not something you can wait on. You've got to immediately address it. And then there are some other resources that's on that page. One very common resource, if you know somebody is really struggling with a lot of anxiety, or they've lost a loved one because of COVID-19, so there's a lot of sadness and prolonged bereavement over somebody passing, or just that somebody's getting very depressed, there's a national site called Psychology Today. It's on our website. If you go to that link, you can plug in the zip code that you're in. You can also put in the distance you want to be looking. You can put in your insurance information, and then you can choose whether you want a therapist or a psychiatrist. One of the things that people sometimes have problems with, they don't know what the difference is between a therapist, psychologist, and a psychiatrist. So fundamentally, a psychiatrist goes to medical school, gets residency trained for 4 years, maybe a fellowship, and a psychiatrist prescribes medications, but also a psychiatrist does psychotherapy. Or everybody else, social workers and psychologists provide psychotherapy, psychosocial interventions, psychoeducation, but they don't prescribe medications. There's another group called the nurse practitioners. They are nurses who have got special training, and they can provide medications and psychotherapy as well. So if you go to Psychology Today, that's one way to do that. And there are links to various clinics. If somebody doesn't want to use a private practice doctor or therapist, they can go to our link. The Monmouth Medical Center has a clinic, Jersey Shore, there's CPC, behavioral health, there's high focus. So there are those issues. And then for substance abuse, if somebody is excessively drinking alcohol or using drugs, which is one of the problems during this pandemic, there's been an increase in substance abuse. There are also links about who you can call to see if that individual might be able to go there and get help. And with substance abuse, as is true with any other condition, the person obviously has to be willing to go, but once they are willing, then that's a resource where it might be best to make inquiries on. And finally, there's always this one other piece beyond meditation, yoga, exercising, trying to eat healthy, trying to make a connection. The one piece that a lot of people don't know about is a Clubhouse model for mental health. And it's a huge successful means to help people who are struggling with mental illness. I was part of the original Clubhouse Fountain House in New York City, so I'm very familiar with it. And then we have our only Clubhouse in New Jersey that has been certified. And basically, it's a different format of being able to provide care for somebody who's suffering from a psychiatric issue, but it's not a treatment modality. It's more of a rehabilitation to get somebody back into the community, to reduce the social isolation, to reduce the stigma, and to help them get back into a work environment and some form of education.
Thank you, Dr. Steve. Jack, can you start with a description of what a clubhouse is and why clubhouses have proven to be so effective in promoting mental wellness?
Sure, thank you. It's an honor to be here with everybody today. And I can't help but reflect back on the family members who really were the driving force behind Shore House, which is really a shining jewel of psychiatric rehabilitation in Long Branch and really in New Jersey, because Shore House is the only accredited clubhouse in the entire state. But it was the passion of those family members that got the seeds planted. Clubhouses are really three things. They're holistic, they're cost effective, and they change lives. They're holistic in the sense that Dr. Steve alluded to, and that they provide an array. A clubhouse is an opportunity center. And so it's a place where people come to during the day. It's not a residential program, but a program that people come to during the day to get help for whatever their recovery goals are. So we help people with reintegrating back into society through helping them get jobs, returning to school, gaining skills to live independently. And as Dr. Steve and Dr. Mama mentioned, the social isolation issue is such a profound factor for people with persistent mental illness. And clubhouses reduce that. You make friends at a clubhouse. Clubhouses are often second families for many of our members. And we use the term member more than client or patient because you're a member of a community and you're part of being responsible for carrying out the responsibilities of the clubhouse. So it's really holistic in that sense, in meeting all the social determinants and quality of life for people. It's cost effective in the sense that clubhouses are purposely staffed low because we draw on the strengths, talents, and abilities of our members to carry out the functions in a work order day structure. So there's a lot of work to do in the clubhouse, ranging from making lunch to answering phones to doing reach out. You may have a horticulture area. The clubhouse has a lot of different opportunities for members to volunteer to get involved with whatever they'd like to. We've also had studies done that show the recidivism in hospitalizations and the usage of high-cost services such as emergency rooms, involvement in the forensic system. And so clubhouses have been evidence-based practices that are cost-effective for every community that has one. When I mention change lives, I reflect upon the fact that I have visited over 150 clubhouses in the 32 countries that we have them in. And inevitably, when I talk to members, they say to me, this clubhouse not only changed my life, it saved my life. And those words are very profound to us who work in the clubhouse model. And we take this very seriously. So I think the reason why it works is because it meets all facets of not just somebody with a mental illness, but just as human beings having purpose in our lives, meaning and constructive things to do during the day and having opportunity to draw upon our strengths, talents, and abilities in a safe, supportive environment that a clubhouse is.
Thank you, Jack. Can you share with us what's happened with clubhouses around the world during the pandemic and where you see clubhouses going in the future as a result?
Sure. Really, clubhouses did a marvelous job of pivoting from building-based services to the hybrid and virtual world. Many of our members have limited phone plans, don't have tablets. So a lot of clubhouses quickly got supports to get those kinds of things in members' hands so they could do Zoom calls. They could meet and have a schedule similar to what they use in their regular work order day to have structure in their day. So people could still work on a newsletter from home, still make calls to people. A lot of clubhouses did an exorbitant amount of meal deliveries, community supports. I remember Journey House in Utah was delivering like 70 meals a day to members and dividing up their catchment area to do that. So meeting the basic needs of members became prominent during the COVID. And as our other panelists referred to, we were very concerned about that social isolation because it's such a precursor that leads to symptom exacerbation. And so all the clubhouses in all 6 continents quickly got well-versed in using the virtual world to communicate with people, to have constructive schedules during the day, to carry out the work of the clubhouse. I think the future is going to be more of a hybrid thing. So if you have a member, for example, that takes 3 buses to get to Shore House and it takes over 2 hours to get there, and they try to get there 4 or 5 days a week, the pandemic has kind of created an unexpected opportunity of people being from home, and maybe they'll call in from home and come and use this type of avenue to still be connected to the clubhouse and participate in the work of the clubhouse, and maybe come in physically 2 or 3 days a week. So we see the model expanding because of this technology, and using sort of a hybrid opportunity to expand the services that clubhouses provide. So even though the pandemic has been so awful in so many ways, as our other panelists have alluded to, clubhouses have done a really nice pivot. And we've met with over 300 clubhouses via this mechanism, and have learned from them, and will continue to share tips and strategies through our website on how clubhouses can make this transition successfully.
I agree with that, Jack, and that pivot we see at Shore House, and it's really been fantastic. We allude to Shore House as the first and only clubhouse in the state of New Jersey. That's both a major problem, but a huge opportunity for our state. What can we do? And I'm going to open this up to everyone here. What can we do to make a change in our own state of New Jersey, in our own communities, and in our own schools to promote mental wellness?
I think it's important to document outcomes. At your clubhouse, you are helping members reintegrate back into society. And how you're doing that, you're helping them get jobs. And so members are earning wages. They're becoming tax-paying citizens in your community. Documenting that is an important way to show the effectiveness. How many people are moving from very expensive board and care homes into their own apartments? So I think you have to be able to make the case for clubhouses to expand in New Jersey through data collection and outcomes. I also think that partnering with other NAMI groups and other people who support this kind of psychiatric rehabilitation is important. What I mean by that is politicians, social workers, folk rehab offices, other psychiatrists, universities and colleges, disability counselors at universities. You need to be kind of form a speakers bureau and get out into the community and make people aware. The clubhouse is the best kept secret in mental health. But if you're out speaking to Rotary clubs, Lions clubs, universities, and broadening your reach beyond just the psychiatric community, but also in the fabric of the community, and become better well known, I think there'll be better buy-in and a greater degree of expansion for clubhouses in New Jersey.
Thank you. Good advice. Dr. Mama, in our prior discussion, you discussed what Monmouth University has done with their telehealth line. If you can elaborate on that a little bit, please.
Sure. We were faced in May with having part-time MSW students who needed to go out into field. And, everyone was struggling in terms of academics. We were all thinking about how we were going to have students complete their field internships in a remote way. We have forever wanted to have a community clinic that the School of Social Work would run, but we've not been able to do it until now. And so we started the Monmouth University Community Care Telehealth Clinic. It's up and running in June. And we have right now, between our summer students and then our fall MSW students, 10 second-year clinical MSW students providing free counseling through telehealth to anyone in the state. It's been a great start to this clinic. We have faculty, our own clinical faculty, who are supervising the students, and they're doing some really good work for people in the community who need a free counseling service.
Thank you. That's a fantastic idea, and something that maybe Shore House can look to partner with you on in the future. Another question. We've mentioned the stigma associated with mental illness, yet the numbers are staggering. We know the crisis continues to grow. Why does the stigma exist in the first place related to mental illness? And do you see that changing with more and more conversation with celebrities and influential people starting to get involved in the mental health conversation?
So Peder, I just, and maybe Robin might want to say something to that as well, but from my own personal experience, the stigma, it's amazing that the stigma is prevalent even in the medical community. So
Mm.
there is a lot of misunderstanding with other physicians who are not psychiatrists. And I think that one of the issues with that and with the general community is this fear of the unknown. People don't seem to really get a good sense of what does it really mean to be depressed? What does it mean to have schizophrenia? What does it mean to have bipolar disorder? I can understand cancer and I can understand high blood pressure, but psychiatric diagnoses are unfortunately coupled, in a wrong way with violence, death, some kind of mayhem. And it's not necessarily true. It's actually a tiny percentage of people who actually do anything that's violent, but there's this association. So I think one is the fear, and the other piece is really not understanding what's actually going on with, or what that means to have schizophrenia or bipolar disorder. So I think we have a responsibility, and I think the American Psychiatric Association and all their district branches, American Psychological Association, the National Association of Social Work, are all trying to make efforts to do a part of education. So I think, like Jack said, I think we need to go out there and be present and have a speakers bureau and get the data and talk to individuals out in the community so they can also understand basically what is actually going on with individuals who are not feeling well, and then the resources that can be provided to them when they're not feeling good. So I think that's a piece that we have to be careful about in being able to educate. And then the one piece that I want to add to what Jack talked about is in New Jersey, one of the biggest problems is that they're very much focused as legislators that services for mental illness or psychiatric care has to be somewhat medical driven. And unless it's medical driven, they won't reimburse. You cannot bill Medicaid, you cannot bill Medicare. It creates a whole system of problems. And so clubhouses are not medically driven. Clubhouses are driven by members, basically. So members come in, they decide where they want to be. They work with a staff member in a work order day to do different functions to help the clubhouse do its work. And it's not medically based. In fact, they leave their diagnosis outside the door once they enter into a clubhouse. And because of that, it creates this problem because 90% of Shore House is all private funding. We get about 10% coming from the county. So we as board members and as a community have to work really, really hard to get the resources from private foundations and private people to be able to have our Shore House, which is the only accredited one in New Jersey. So we'd have to really do a lot of work to try to get the legislators to kind of understand what we do. And we have tried to partner with other organizations, but they have also had problems because of this dilemma in New Jersey where they expect everything to be medically driven.
I think also, Peder, along the lines of stigma, is that it sells. You see in the movies, you see on TV, Dr. Steve mentioned the myth of violence. People with mental illness are more likely to be victims of crime than perpetrators of it. But it sells. So the more that celebrities, athletes, politicians, well-known people come out and talk about their own experiences with their mental illnesses will help reduce it. I think back to the HIV/AIDS, when that first came out, people were scared and very leery of anybody who had that. And that's really waned away now. And I would hope to see that same thing happen with people with mental illness, that people with mental illness can be productive citizens in the community, and they're human beings and have the same needs and desires as anybody else does. And so being in this field for over 35 years, my kids grew up around the clubhouse that I worked in. We know factually that this model works, and people don't need to fear folks with mental illness. Just along the lines of the Medicaid thing, we have over 150 clubhouses in the United States who receive Medicaid funding. And we've done work with the Center for Medicaid and Medicare Services and have an activity table that the Federal Center for CMS has approved for the types of activities that clubhouses do. So I agree with Dr. Steve that we need to educate the state Medicaid offices and potential government funders that this is a piece that is effective and they should be a part of in their communities. And so we look forward to partnering more with Shore House in that capacity.
I thank you. I also think that if you think about the statistics globally and this idea that 1 in 4 adults at some point in their life will experience a mental illness or a neurological disorder, it means that we really have to think about health in both physical health as well as mental health. And I think in the past, we've put mental health to the side. We think of physical health when we think of health. So when we think of our own health, we have to think that we have physical health and we have mental health. And when we incorporate all of that in, I think that will also help to reduce the stigma, because it's just part of overall health.
A big thank you to our panelists on what we hope you agree was a very enlightening discussion on what we realize is a very hard-hitting topic. COVID-19 and the effects on mental illness will continue to be an important conversation piece during these dynamic and uncertain times. This should put the pressure on all of us to address the mental health crisis with more urgency, with more attention, and with more resources than ever before. I'm confident that Clubhouses, and more specifically, Shore House in New Jersey, as the first and only accredited clubhouse, will be the go-to resource to help our friends, our colleagues, and our loved ones deal with their mental illness and return to a life of happiness and productivity. As we've heard, the Clubhouse model is proven to be extremely effective throughout the world in treating mental illness. In fact, the 310 plus clubhouses around the world are funded primarily with government support based on the success of their program. Here in New Jersey, we have a different story. As we've heard, we receive less than 10% of our funding from the state. In fact, 10% of that comes from the county of Monmouth. That means over 90% of our funding comes from donors just like you and me. We need to change that narrative, and I'm asking for you and me to be part of that solution in bringing the Clubhouse movement to New Jersey beyond Shore House. Thank you for your support and for listening into our panel.